Hello. Hope everybody's doing okay today. I am Dr. Toombs-Withers, and I'm coming at you live from Essence of Health Wellness Clinic here in Chattanooga, Tennessee. Today, I'm here to bring you some updates about coronavirus, COVID-19. I'm here to arm you with knowledge and to hopefully ease some of your fears about COVID-19. I am breaking this chat down today into two thoughts, and I've titled it What We Know About Coronavirus and What We Don't Know About Coronavirus. So I'll start by telling you about what we do know. So, things that we do know right now are the symptoms of coronavirus. So, what are those symptoms again? Cough, fever, and shortness of breath are the three big ones that we're really looking out for. And from what we've seen is cough is more of a dry, hacky kind of cough. The fever, we want to keep in mind that a fever is defined as a temperature that's greater than 100.4 degrees. And then shortness of breath, feeling like you're having trouble breathing or having difficulty catching your breath. So that's what we do know. We know those symptoms of coronavirus. More things that we also know is how to prevent coronavirus, some ways to prevent it. And so some things we found in terms of prevention is washing our hands does help to prevent the transmission of disease. And remember, when you're washing your hands, you want to remember that you're washing your hands for at least 20 seconds to make sure that you are getting a good wash of your hands using soap and water. And at minimum of 20 seconds. And you can also use the alcohol-based hand rubs, the hand sanitizers. That also works well in terms of keeping your hands clean. However, when you use those alcohol-based hand sanitizers, you do want to look at the alcohol content and make sure that it's at least 60% alcohol in the hand sanitizer that you're using. I know I have seen personally on the shelves here recently that the shelf would be wiped out of alcohol, and then you may see like a couple of 10 bottles left of one particular alcohol. And then when you look at it, it's because that alcohol is actually not strong enough for what you need. So do make sure that you're looking at least that 60% in terms of the alcohol content for your alcohol-based hand rubs and hand sanitizers. Something else we know in terms of prevention is don't touch your face, your nose, your eyes, your mouth, because that can help to cut down on the transmission and spread of disease. When we are touching our face and our mouth and our hands, we can actually be exposing ourselves to things that we may have touched on our hands from surfaces and increasing our risk of disease that way. Something else we know in terms of prevention is that distancing ourselves from others has been helpful to prevent the transmission of those respiratory droplets that can increase risk of disease. And so it's recommended that you distance yourself for at least 6 feet of distance in terms of preventing those respiratory droplets from landing on you and increasing your risk of capturing this virus. And so that is why we've seen across the country now where social distancing has been recommended. I know here in Tennessee now, there are several schools that have closed. There have been several public places where they're not recommending mass gatherings. There are several local events that have been postponed or canceled. And that's why, because we want to limit transmission by having people just distance themselves for now, so that we can, catch up and we can prevent this virus from rapidly growing and rapidly spreading. And so also with that said, in terms of prevention, if you are ill, then definitely stay home because we don't want to infect others. Adults, you certainly don't want to go to work and then infect your coworkers, and because that can impact your entire business, that can which can in turn impact your livelihood. So if you are ill, stay home. Those people who can work from home or can work remotely, then do that so that you can also create that distance and protect yourself and protect others. What we also know in terms of healthcare. So according to the Tennessee Health Department, And this is as of this morning when I checked, we have 18 total positive cases of COVID-19 in Tennessee. The majority of those cases are in Davidson and Williamson counties. As of right now, there have been no positive cases here in Hamilton County. Local testing has become available in hospitals, and there has been testing as of this week that's become available in local outpatient clinics. And so that's something to keep in mind. So if you are experiencing these symptoms, we do have availability for testing. I will say that with the caveat that testing is limited. So be sure that you contact a healthcare provider or the healthcare facility before arriving to make sure that you do warrant testing, because everybody does not warrant testing. That we are looking out for those symptoms that I mentioned earlier in the chat. And then the current recommendation for many facilities is to call or to notify that staff immediately before just showing up. They do want to protect the healthcare workers. We want to keep our doctors and our nurses and our respiratory therapists. We want to keep all of these people really healthy so that they can help the most critically ill out there. So if you are experiencing these symptoms, call ahead and let them know, give them a heads up as to what's going on. Particularly in hospitals, many of them have instituted a screen at the door approach. So they will probably ask you these questions about cough and flu, shortness of breath, your travel, and high risk group category. And then at a lot of healthcare facilities, as soon as you arrive, they may place a mask on you to prevent the spread and transmission of any potential viral contaminants. And you, beyond notifying that staff that you are ill with these potential symptoms, you also want to be sure to notify them if you're in a high risk group, because that also puts you in a different category in terms of what we're thinking with your risk of having coronavirus and spreading coronavirus. And so I wanted to talk a minute about what these high risk groups are. So currently high risk groups are if you have been in contact with confirmed cases of coronavirus. And so, we know some of the areas where these confirmed cases are now. So if you've been in contact with those cases, or if someone in your home has been tested positive for coronavirus, then yes, that places you in a high risk category. Healthcare workers, so our doctors, our nurses, our respiratory therapists, our cleanup staff, even anyone working in a healthcare facility, you're considered in a high risk group. Occupations with exposure to a mass number of people. So teachers, ministers, cashiers, even because they work closely to people and those respiratory droplets may come into contact with them. So you are considered in a higher risk category by working amongst masses of people. Nursing home residents, we saw the large outbreak in Washington from a nursing home. Severely immunocompromised patients. So these are people who have underlying lung disease, certainly our cancer patients, dialysis patients, even those patients who may be being treated for diseases, for instance, like arthritis with some immunosuppressive type drugs. You are considered high risk because your immune system has been weakened. Also, pregnant women. So pregnant women is really by motive of pregnant women considered high risk because of a decreased lung capacity. Sometimes, depending where you are in pregnancy, your belly may make it difficult for you to take a full breath and to allow full expansion when you're breathing. And so that also places you at an increased risk category. And then people who have traveled to known areas of high risk COVID-19 cases. So at that point, Washington State, New York State definitely have an increased number of COVID cases, or even here in Tennessee. So if you've been in Williamson or Davidson County and have been in contact with individuals there, you would be considered to be at a higher risk there at this time. So that was, a lot of things. So we do actually know a lot of things about coronavirus right now. But now I'm going to tell you some of the things that we don't know right now about coronavirus. And so a big one is treatment. We don't have any vaccine available for coronavirus. There's no magic pill that we can give you to treat your coronavirus and to get you over it. So we don't know that right now. The care that people are getting in hospitals is what we call supportive care. So you're getting oxygen, you're getting medicines to help you breathe, you're getting that type of treatment. But there is no coronavirus cure that has become available as of yet. Something we also don't know is how many individuals are infected, actual numbers out there right now. And the reason we don't know that is because testing has only recently become available, and testing is still not not available in masses right now. Even our hospitals and our health clinics that have testing available, it's in very limited supply. And so that's why we're categorizing people in terms of symptoms and in terms of if you're in these high risk groups. So we truly don't know how many people are infected because we don't have enough tests to test everybody at this point. And so we may, see more numbers increasing from that. And then something else we don't know is we don't know when someone is infected. Symptoms may appear 2 to 14 days after you've been exposed to coronavirus by someone. And so, if you think back into the way that looks, especially people who may have those occupations we talked about where they're around masses of people, they could have been exposed but may not have developed symptoms yet. And so they're still out there. And so that kind of brings home the point as to why social distancing is being recommended right now from a public health perspective, because this 2 to 14 day incubation period from where a person could have been exposed, but they still may not have symptoms as of yet. And so if we just distance ourselves and just don't expose ourselves to each other right now, the thought is that we may be able to prevent more individuals from contracting this virus and prevent deaths from this virus. So in closing, knowledge is power. Prevention, as we know, is power. And the essence of health is in you. I will be paying attention to the comment section on this Facebook Live feed, and I am happy to reply to any questions that anyone may have. Remember to check out Essence of Health website at www.essenceofhealth.com. Also, remember to take a look at my Instagram page. It's also at Essence of Health Wellness Clinic. I am accepting new patients. You can give me a call at 423-225-2245 for more information of how to join the practice. Thank you for joining me today.